Hello, my name is Gary Lai, and I'm the 2020 AREAA Northern New Jersey Secretary. And I'm here today with Miss Rose Tran, who's a family nurse practitioner working in New Haven County, Connecticut. She's been practicing nursing for the past 10 years, with the last 5 years dedicated towards family practitioner. We are here today to discuss the current health environment. Obviously, with COVID around, there's been a lot of misinformation and just a lot of information that is just changing day to day. What we wanted to do is actually take some time and to dispel some of the myths out there and actually get the true practices that we should be right now. So Rose, thank you for taking time to sit with us. How are you today?
I'm good. Thank you for having me. It's an honor.
Well, thank you for taking the time. So I guess my first question is, what is it like for medical professions today on the front line that's battling COVID?
Yeah, I think it's safe to say, and a lot of us will agree, that initially it was very scary. It's frightening, mainly because there were so many unknowns, right, and complicated by the facts that our policies regarding PPE and everything were changing constantly. And so you had to accommodate for that. For me personally, like you said, I work in the outpatient setting. So my main focus during this COVID pandemic has really been on trying to keep my patients as clinically stable as possible outpatient, and as a result, prevent as many hospitalizations as possible. As we know through the media and whatnot, the hospital workers, those are the ones who are really fighting this intense battle. They are the ones who are becoming incredibly overwhelmed. Oftentimes, they're working with a shortage of personal protective equipment, so PPE.
Yeah.
They're reusing a lot of their N95 masks, which really isn't best practice at all, right? And then on top of that, they're working short-staffed, which was already a problem before COVID, and even more so a problem now during the COVID pandemic. At the end of their shifts, they're worried about bringing that COVID infection home to their loved ones and their families. And we see that a lot of our healthcare workers, especially in New York City, what they're doing is they're staying away from their loved ones. So they're staying in hotel rooms and other accommodations. So you can see that it's definitely emotionally tolling, right?
Right.
A lot of our hospital workers specifically. But I have to say that we have been getting a lot of outpouring of love and support from our friends community, and even like the local restaurants, fire departments and whatnot.
Right.
Just put this on. It does a lot for morale.
Yeah.
I know that the healthcare workers specifically, you see the sickest of the sick, right? And so can you imagine, just like shift after shift, you're seeing this concentrated population of acutely ill individuals. And so that does something to your spirits. So those little gestures that our local communities have been showing to us are really uplifting. And I know at Yale New Haven Hospital specifically, the main hospital here in my county, every time a COVID patient recovers, a snippet of the song Rise Up from Andrew Day plays. And so no matter like what you're doing, how short-staffed you are, how busy you are on that floor, if you hear that, it's a win. You know what I mean? So it is something that keeps you going. I think it is safe to say that as a member of the healthcare community, it really is an honor to be in a position where we can help others. It is still frightening. You know, the last few months really have been frightening, but we are grateful to be able to help. Okay, yeah.
No, listen, that's great. I mean, we really appreciate everything that all the healthcare professionals are doing at this time. You know, we wish that us as individuals could do more. You know, so what are some of the best items that we can help donate at this time?
Yeah, so that's an awesome question. So like I was mentioning earlier, it's really the PPE that we need, because we need to protect our frontline workers in order to keep them working and in order to have them continue serving the communities. So if you have disposable gloves, whether they're nitrile or latex, droplet or surgical masks, N95 masks, disinfectant wipes, face shields, goggles, hand sanitizer, right? You just want to visit the website of your local hospital or healthcare facility. A lot of times they have directions and who to contact regarding how to donate those items. That would be greatly appreciated.
Okay, excellent. So so you mentioned about the N95 masks, right? Because obviously we want to reserve those for the healthcare workers, because you guys are the more important people right now, because you are on the front lines. So if it's not the N95 masks, what type of mask should we be wearing? And really, what are the best practices for sanitizing and sort of reusing masks?
Yeah, so right now in the public setting, what's recommended by the CDC is that all individuals wear a cloth mask when you're out and that there's potential to be within 6 feet of someone else. This is my own cloth mask that I wear out when I'm in the public
Okay.
setting, okay? You're right, N95 masks and surgical and droplet masks really should be reserved for the healthcare workers at this time. Cloth masks, however, are easy to make at home, even if you don't have any sewing skills, right? The CDC is a great resource for this. If you don't have the ability to sew, you can makeshift a mask with a bandana or a neck gaiter that you wear during the winter, and 2 hair ties or rubber bands to make the ear loops for them. If you do know how to sew, there are directions on the CDC website on how to do that as well. But I did want to take the opportunity to really clarify what a cloth mask does, right? So when you wear a cloth mask, know that you are protecting others from yourself if you happen to be sick or if you happen to be an asymptomatic carrier of COVID. And know that when you see someone else with a mask on, they're protecting you, all right? And you can further protect yourself by keeping that 6 feet distance and by not bringing your hands to your face and making sure that you wash your hands frequently.
Okay, that's very good information to know. I guess a follow-up to that, because everybody's talking about wearing masks, gloves, and all this thing. I guess some of the people out there, they also want to know, well, what about goggles, right? Because that's another entry point.
Yes, absolutely. So COVID can get through to the eyes via splashes and sprays, and that's what goggles really protect you against. For healthcare workers specifically, why they need to be wearing goggles, especially when they're providing care by the bedside or within 6 feet of that patient, is because of those splashes and sprays. So when you're suctioning someone, for example, somebody has a lot of oral secretions that you need to get out of their airway so they can breathe better, you have the potential for infecting yourself through the eye. But for the general public, droplets don't typically travel farther than that 6 feet. So as long as you're keeping that 6 feet distance, and you really don't need to be wearing a goggle at all. And on top of that, if others around you are wearing a cloth mask and you're wearing a cloth mask, that risk for transmission is even more greatly reduced. So no, the answer to that is you do not need to be wearing goggles in the public setting.
Okay, all right. So no goggles, but definitely, obviously, face masks and also gloves. Which definitely I do see a lot of people wearing that out about these days. But one of the strangest things to me is when I'm in the supermarket and I see people wearing the mask and the gloves, but then they're sitting there just sort of touching everything with their gloves, touching their phones and everything. So, obviously, I don't think that's safe. So in your mind, what are some of the best practices when you are out shopping, grocery shopping specifically?
Yeah, so really good point about the gloves. Okay, so as of now, as of today, and this may change, things are changing all the time.
Right.
The CDC does not recommend that you need to be wearing gloves in the public health setting, in the public setting. Okay, so when you're grocery shopping, if you absolutely want to wear gloves, it really should be because it reminds you not to touch your face. Okay, gloves should never substitute for hand sanitizing and hand washing. All right. In fact, a lot of people in the public setting, if you're not using gloves correctly, you do risk cross-contamination and you do risk yourself becoming infected. All right, so if you are wearing gloves to the supermarket, you want to make sure that you're not touching everything. You want to make sure that you're not incessantly touching your phone. You also need to make sure that once you leave the supermarket, you are taking those gloves off and disposing them in the garbage can right outside the supermarket before you then touch your groceries or bring them into the car, okay? But you bring up a good point about grocery shopping etiquette in general during this time. My recommendation really is to condense your grocery shopping trips. You don't want to just go for 1 or 2 items. Go ahead and jot those items down on a piece of paper, okay? I do want to recommend against putting those items in your phone. The last thing I want you to do is reach into your phone during your shopping trip and, potentially
touching your face.
Yeah, exactly. Contaminate your phone. You also want to designate one person to go at a time from your family. You don't want to go in hordes at all. Ideally, that family member should be feeling well, okay? And you want to also make sure you're wearing that cloth mask when you're inside the grocery store. You want to keep a good 6 feet distance from other people. Once you're done collecting your items, you want to be as efficient as possible. And now you're at the checkout line, go ahead and try to use a no-touch payment method like Apple Pay. If that's not possible, use a credit card. It's better than cash, okay? You don't want to be risking handing anything to another person. Once you're back home, let's say you're home now, you have your bags of grocery, you do not need to wipe down and disinfect or bleach any of your produce or your meats at all, okay? Because a lot of that packaging is not meant to take disinfectant chemicals, and you can actually risk contaminating your food. So as long as you are putting everything on the counter, you wash your produce with fresh water, and you put your canned goods away. Canned goods actually can be wiped down if you want to. Wash your hands right after you unpack your groceries, wipe down the counter after you unload your groceries, and you're good to go. You really don't need to do much else after that to disinfect them.
Got it. Okay, so no bleach on food, on fruit or meat. Okay, that's good to know. No, we don't do that at our house. So once we go shopping, we usually just take some isopropyl alcohol and just spray some of, like I said, the boxes, the canned goods, everything else, like you just said, like we wipe down, thankfully.
Good. And if you don't wipe things down, like with canned goods, you leave them out for 72 hours, they're good to go. It's not viable on surfaces, on many surfaces after 72 hours. So if you leave them out, and
really, okay,
that's fine too.
So I guess I have a question. So obviously, during this time, a lot of people are staying at home, right? So they're doing a massive amount of online shopping, right?
Yes.
What is your take as far as disinfecting or just boxes from it? Because obviously, there's an article a few weeks back that dozens and hundreds of Amazon workers are infected.
Yes.
So obviously, people are worried about their packages. So
yes.
What is the best practice, and what do you recommend?
Yeah. So what I recommend is that I wouldn't be too concerned about viable COVID droplets on your packaging, okay? On cardboard specifically, which a lot of our packaging comes in, a lot of studies have shown that that virus is not viable on cardboard for more than 24 hours. On certain other surfaces, it's 72 hours, but cardboard specifically, it seems to be at 24 hours. And if you're really worried about it, you can go ahead and take the package into your home. You can open it up, then you go wash your hands really well, and the contents within that box should be okay. All right, so you don't need to do any kind of crazy ritual for disinfecting everything that comes to your door via mail at all.
Gotcha. Okay. That's good to know. Obviously, for everybody that's at home shopping because there's nothing else to do.
Yeah, no, I get the concern. Yeah.
Yeah. So I guess my question is, when does this cycle stop? When everybody's going to be wearing masks, gloves, PPE? Is it sort of when this is all over? Is it which we don't know. Is it going to be when vaccinations or cures discovered, or like what are your thoughts on that?
Yeah, so the day that we completely stop PPE, so the day that we tell people, okay, you don't need to wear a mask at all, that really will be when we have a significant containment of the virus. So yes, that probably will be the time when we discover an effective vaccine or game-changing therapeutic, right? I do have to say that stay-at-home orders, though, are different in the sense that they will fluctuate, okay? So lifting stay-at-home orders will really depend on how well we all social distance from each other. Technically speaking, generally a few weeks after you have a sustained reduction in COVID positive cases, you can start to lift certain stay-at-home orders in a staggered fashion, okay, and slowly reintroduce that. But before that, you have to make sure that testing is available, right, that anybody who has COVID-like symptoms have access to testing so that they can do also some close contact tracing. And before you lift those stay-at-home orders, you have to make sure that your healthcare system and your hospitals have rebounded so that they have the capacity to take care of newly COVID positive patients. And likely we'll be seeing this in a cyclical fashion until that vaccine or likely that game-changing therapeutic, right? So we social distance, we do a good job doing that. So our stay-at-home orders lift, and then we'll see a COVID infection rise, right? The rate of that rise, and then stay-at-home orders will reinstate, and so on and so forth until that vaccine comes into play.
Gotcha.
Mm-hmm.
Okay. So obviously, like you said, I mean, there's been a tremendous amount of misinformation sort of out there, right? What are some of the more popular myths that you've been hearing that, you know, that you just want to clear the air about?
Yeah, I think the main one is medication or treatment related. I get it almost on a daily basis from my patients, and I get it. You know, when we're going through something as devastating as this, you want to be hopeful that something can really help you, right? And so I don't blame people for being hopeful about that. But I do have to address the use of hydroxychloroquine. I'm pretty sure that you've heard that throughout
Yep.
the media and pretty frequently throughout this pandemic. So hydroxychloroquine, as you probably already heard, is a medication we often use as an antimalarial. We also use it in a lot of chronic conditions like rheumatoid arthritis and lupus. It was the thought that hydroxychloroquine could contribute to an anti-inflammatory response against COVID, right?
Mhm.
And so right now, it's by the FDA, it is only authorized as an off-label use in hospitalized patients where they are closely monitored. Okay, hydroxychloroquine itself does have some cardiotoxic side effects that require close monitoring. And so for that reason, we're only giving it really in a hospital setting where we can monitor that. As of today, okay, and this may change, as of today, all of the clinical trial and all of the data that have studied hydroxychloroquine have been inconclusive. Okay, so it doesn't recommend for or against its use at this time. So right now, until we have more studies that support its use, it would be negligent of myself and my healthcare colleagues to be mass prescribing that in the outpatient setting at this time, at least until more data is collected. And I have to say that very similarly, that goes for azithromycin, Z-Pak, right?
Yep.
That's a really common antibiotic that we often give in the outpatient setting for bacterial pneumonias, certain bacterial respiratory conditions, sometimes ear infections as well. And a lot of patients have been requesting that, but the only reason why you hear about hospitalized patients getting azithromycin routinely is because they have developed a superimposed or secondary pneumonia on top of their COVID respiratory infection. Luckily, the majority of the outpatient population don't develop that secondary bacterial infection, so we don't need to give azithromycin. It unfortunately doesn't have any effectiveness against any virus, let alone coronavirus. Okay, so those are the two main medications I hear about pretty regularly.
Well, so I guess that brings me to my next question there, right? So you brought up medication, treatment, anything like that. So are we having success treating those who've tested positive for COVID?
Yeah, well, there's still a lot to learn and to
Right.
do regarding treatment, but I just wanted to make a point to say that luckily, the majority of COVID positive patients are stable enough to heal and get better on their own in the comforts of their own home. Okay, that is thought to be about 80% of the population who test COVID positive. So that's great, right? And then we talk about the 15% of COVID positive patients who have what we consider more severe disease, and they often feel bad enough where they need to have an ER visit or they get hospitalized for a short period of time in a non-ICU floor, right? They may just need some supplemental oxygen and some close monitoring while their lungs heal and they're stable enough to get discharged home. And then you talk about the 5%, right? The estimated 5% that develop what we consider critical disease. And these are often patients that go into respiratory failure. They're patients who go into shock and have multi-organ dysfunction or failure, and they require extensive support. These are the patients that you hear on ventilators, okay?
Wow.
And yeah, and on these acutely ill and critically ill patients, there is a lot of anecdotal treatment that we're employing in these settings. Right now, there's still so much that's unknown about COVID, and we still have a lot to study. So I can't speak to its effectiveness yet because a lot of that treatment is anecdotal, like I said, and there's still a lot of trials that need to be done to speak to the safety and effectiveness of these treatment regimens.
Gotcha. Okay.
Yeah.
Um, so I guess the question would be then, for the people that are fortunate enough to obviously recover, right,
Yeah.
from COVID, would it be helpful to have their blood tested for the antibodies? Like, and like, are there separate antibodies? Because I've heard I guess some terminology, short-term antibodies, long-term antibodies. What does all that mean? It's obviously confusing to somebody that doesn't really speak
Yes.
that language.
Yes. So antibodies is your body's defense against a certain infection. So we build antibodies after a short while after we're acutely infected. That's our body's way of saying, hey, if I'm reinfected with the same organism, my body recognizes it and can fight it off. All right. So in terms of COVID right now, though, yes, there's an antibody test that came out here in Connecticut. I'm not sure about New Jersey, but we have been able to order that test for about a week now, right? Last Friday, I believe. And its utility is still not very clear, okay? It seems like it's used more for epidemiologic purposes at this time. If you test positive on an antibody test, it doesn't necessarily confer immunity to reinfection, right? And so we don't know that yet. So if you have COVID this season, can you get it again next season? We don't know yet. But hopefully the more we find out and the more people test, we can look at the immunity patterns and have a better idea of its nature and recovery, But right now, what they're doing also is a lot of plasma. They're requesting a lot of plasma donation. The National COVID-19 Convalescent Plasma Project lists a lot of places that you can donate. So if you're a COVID recovered patient or know somebody who is a COVID recovered individual, you can visit this site. And I know in New York, Mount Sinai, Montefiore, and New York Blood Center are currently accepting plasma donations. And in New Jersey, Hackensack Meridian Health is also doing that. If you go onto that Hackensack Meridian Health website, they do have an eligibility form that you can fill out if you're a COVID recovered individual. You can give a blood sample, and the objective is to find the blood sample with the highest targeted antibodies. Once that group of individuals is identified, you're asked to return and give a larger plasma donation. And the hope is that if we infuse this into somebody who is acutely ill in the hospital and who's not doing very well with COVID, perhaps there will be clinical improvement. Again, that is still trial. This is still a lot of data that we're collecting. But the answer, yes, it probably would be helpful. It will give us some insight, but I can't say what it necessarily means at this time because we don't know.
Gotcha. Yeah, no, we definitely understand. It's obviously a very fluid sort of situation in the health environment right now. There's obviously a lot of trials out there to find vaccines. Also new tests coming out. Like I just saw recently that Rutgers got FDA approval for a saliva test, so I'm hoping that'll help for mass testing. I'm hoping. So I guess my next few questions are going to be sort of geared towards our membership base, because obviously a lot of us are in the real estate sort of profession. So for our realtor friends out there, and I mean, I guess this could speak to your brother, who's also a realtor.
He is.
Yeah. How long should we sort of wait, or realtors should wait in between showings to allow other clients to sort of view the properties? Should they go back to back? Should they only do vacant? Like, what are your thoughts?
Yeah. So my thought on that is, if a property has been unoccupied in the last 72 hours, I think you can conduct those showings relatively safely. Okay, because like we were mentioning or discussing earlier, the coronavirus has not been shown to be really viable on the majority of surfaces past that 72-hour period. I do recommend that when you meet your client at the property, you guys are in your respective cars, that both of you as a real estate agent and your client, don on a cloth mask prior to getting out of your cars. Both of you should sanitize your hands really well before you enter the property. Okay, and try to keep that 6 feet social distance and physical distance from each other while you're in the property itself. And if a place is too small to allow for that, so if you're in a bathroom or maybe a closet, go ahead and let your client see that area on their own and then meet them in a different room. You also want to make sure that you are kind of disinfecting a lot of the things that you touch on your way out, really for courtesy of the next person who's going to be coming in. Right? So that makes sense so far. I would be cautious about showing homes that are currently occupied. Okay, not to say that it's a hard no, but I really would be cautious with this. And the reason I'm saying that is because there is a higher legitimate risk of you having droplet transmission, right? So as long as the occupants aren't home, that kind of reduces your risk, but be mindful that the occupants on that home, they're not wearing a cloth mask. I mean, I don't wear a cloth mask when I'm home, right? And so when I'm speaking or when they sneeze or when they brush their teeth, yep. Right, now they're transmitting their droplets onto common household surfaces. Now the hope is the occupants on that home feel well and they're not COVID infected, but you have to be mindful that there is a small section of the population, percentage of that population that are asymptomatic carriers. So be mindful that that risk really is there. Obviously, the precautions that we were discussing with an unoccupied property, you want to bring in to your occupied property. You want to wear the cloth mask to help protect the occupants when you leave. You want to sanitize before you go in, keep the 6 feet social distance, be careful in common areas like the bathroom and the kitchen, and do not bring your hands to your face at all during that showing. Once you leave, sanitize your hands really well. Okay.
Gotcha. Okay, it's good to know. And you just mentioning not touching my face. Unfortunately, I know I've touched my face a few times during this interview.
It's a bad habit that we all need to break, myself included.
I'm definitely trying to break it.
Yeah.
So I guess the next question is, this is geared towards actually most of our membership database, because we're trying to go obviously as much paperless as possible. You're doing e-signs and docu-signs and all that stuff, right? But if we had to, right, what is the protocols and how safe is it to be handling paperwork? Specifically, so loan officers are sometimes collecting documents from borrowers that actually want to meet in person because they don't have a scanner, realtors that have to get actual physical signatures on contracts, or even attorneys and title companies at closings if they're not set up for e-notary, sort of the virtual closings, which unfortunately a lot of title and a lot of attorneys are not set up and they're not approved for it. So okay. What is your recommendation? What are your thoughts?
Yeah. So ideally, like you were saying, if you can virtually sign, that eliminates the potential of transmission completely. So that would be great. But I understand that there are some barriers with the municipality and the parties. But what you're doing now, if you drop off paperwork to be signed, that's absolutely fine. The main thing is just making sure that you're practicing good hand hygiene before and after you handle those papers. And as long as you're signing and not bringing your hands to your face, you don't have to worry at all. It's not like there's a risk for airborne transmission at all from those papers. So what you're doing now in terms of bringing your papers to your client to sign and then them returning it, that's absolutely fine. Just practice good hand hygiene. That's all.
Good. Okay. That's good to know. That's some good advice. So I guess before we let you go, I just sort of want to know, so what are your thoughts? What are your 5 sort of must-dos during this time?
Yeah, so a lot of this we went over already, which is great. So my 5 recommendations are: keep that physical 6 distance at all times if possible. 2, you want to wear a cloth mask every time you're out, outside of the home, and there's potential to be within 6 feet of someone else, okay? Because know that we all protect each other when we all wear a cloth mask. You want to make sure you're washing your hands frequently is number 3, right? At least 20 seconds with soap and water, all right? And that's every time you come back into the home and frequently throughout the day if you cough or you sneeze, okay? Like Gary and I were talking about, you want to make sure you break the habit of bringing your hands to your face, because then you can definitely bring the virus into a ways of getting into your immune system. So you want to avoid that completely. If you're a contact lens wearer, by the way, you want to make sure you're wearing glasses instead, because contact lens wearers happen to touch their face more. Okay. Wow. And I do want to encourage everyone to be patient. I know it's been really hard over the last few months. I want everyone to really practice some flexibility as well, because as you know, the healthcare policies and the recommendations are really changing very fast for us and for the public. And so you really want to make sure you keep each other safe by going to the CDC or the World Health Organization websites if you have any questions. But as of now, I think that we really should continue social distancing and practicing the good infection control measures we were talking about. And it is something that I think we will get through. It's just a matter of saving as many lives and causing the least amount of devastation as possible as we get through it. Okay.
Perfect.
Yes.
Thank you so much for all
You're
this.
welcome.
So, I just really want to say thank you again for taking the time out to speak with us and to give some feedback and some advice to our membership base. I want to thank you for just being in the healthcare and just being on the front lines and just battling all this. What we're going to do is, I'm going to set up a link, the links that you had mentioned before for the National COVID-19 Convalescent Plasma Project. We'll do the Hackensack Meridian sort of COVID-19 sort of website.
Great.
If any of our membership might have questions, would you be opposed if we just emailed them to you and you could sort of?
That's absolutely fine. Yep, you can forward them to me. I'm going to try my best to help.
Perfect. I appreciate it. Thank you
No
so
problem.
much for your time.
No problem. Thank you. I hope you stay healthy.
You too as well. We will speak soon. Thank you again, Rose.
You're welcome. Bye, guys. Thank you.
Bye.